Hey everyone, Peter here from Team Sapiens PT. I had another interesting low back pain scenario develop in a session today. So this individual I've been working with for a number of months. When his back pain first began, it was a quite irritable and severe episode. They were very limited in what they could do on a day-to-day basis. So he's come a long way in terms of recovering his bending, his twisting, other ranges of motion. Mainly what I've been focusing on with him is building confidence in himself and also having that thought that the body's not fragile and reinforcing that it's resilient despite what he's felt in the past. I think that has come from an avoidance kind of mindset where you hurt your back bending forward, don't do that kind of thing. Yeah, maybe temporarily, but like as I said in the previous video, you got to build that stuff back up so that you can go there confidently. So he's been responding well to those types of interventions. The past couple weeks he's come a long way in terms of bending further forward, twisting further, combining both of the motions, even adding some speed into the equation with doing some drills and exercises with medicine balls in terms of slamming them down forcefully, throwing them while twisting, catching them in a difficult position where it'll challenge his trunk more. And the interesting part about today's session was just kind of offhand. He had mentioned that, in a few weeks, I'm going out west, and a few of my buddies are bringing their kids. I'm bringing my son. They're thinking about skiing, but I don't think I'm going to go. I just don't want to risk it. I don't think it's worth it. Which could be potentially a smart idea, but I also don't want him to limit himself. Like, who knows how he's going to be feeling in a few weeks. He's been every single week for the past month or so, been doing much better. So in another month from now, he could be totally fine for all he knows. So I wanted to keep that option open. So I didn't necessarily confront him with that, but that got my brain turning in terms of what we were going to do in today's session. And I called an audible about, instead of whatever I had planned, started thinking about what is different about skiing that we haven't really tried to replicate here in the office. So skiing is a very lower extremity dominant activity, but it also involves a lot of trunk musculature in terms of fighting the different forces as you're going down the slope. So from a movement perspective, the focus has kind of been on above the pelvis so far these past few weeks in terms of getting him bending and twisting and doing things with his arms. So to kind of mimic more of a skiing type of activity, had to think of something with the legs. So first thing that came to my mind is jumping. So I set up a few weights on the ground as a platform. We started with 2, but I just had him start jumping to it. Like I said, in the first set, I just had him do 2, asked him how it felt, fine. I also asked, how's the height of the platform? It's like, it's good, but, I feel like I can do more, which is another important aspect about kind of how you can lead people into making certain decisions, hopefully, with what direction you want it to go in. I didn't necessarily tell him I wanted to do more, but I gave him the opportunity to potentially make a choice to make it harder on himself when he did, which I thought was awesome. It's a sign that he's willing to challenge himself, which is a great sign. We also talked about how we could eventually progress this into a drop jump where you're stopping your momentum on the way down, which is a little bit more forceful for the legs and also the trunk. And then this can eventually turn into a lot of skiing similar type motions where you're maybe going off to the side, and then eventually slaloming down the track. So I'll be interested to see, after doing more things like this, what his attitude is in a few weeks about that skiing trip. Again, it doesn't necessarily matter to me if he goes or not, but I think from knowing where he's come from in terms of some of the beliefs he's had about certain movements and his fears, it'll be really interesting to see if he opens up to the possibility about doing that. because I don't see any danger with him pursuing that. I think he'd be totally fine based on everything that he's doing here and at home. I wanted to highlight kind of what happened today. Calling the audible. I think the way that Team Sapiens is organized is seeing patients one-on-one. It allows for those kind of happy accidents to occur where I'm having a discussion with the person the whole time, and it gives me the flexibility to call the audible if I need to, if I recognize something that otherwise wouldn't. It might seem like nothing at the time to the person, but it gives me an indication in terms of where their mindset is and kind of how it's affecting their life and where I can step in and potentially help them move forward for that. Another important principle here is with more chronic back pain type cases, most people with chronic back pain tend to move slower than people without symptoms. Another component that went into my decision making, which has been in the past few weeks with kind of the upper body focused things, to not only increase the load of certain things, but also the speed of movement, which is a confidence building thing, because someone that is very guarded, fearful of movement, will move in a very blocked fashion and also very slowly. Taking steps to increase the speed of movement in terms of what the torso or the spine is responsible for can have a big effect on someone's confidence. So I think that it's showing in this person. And like I said, it'll be really interesting as we start doing some lower body focused things, including some jumping, how his attitude will change in terms of that skiing trip. So I hope you guys found this interesting. I thought it was pretty cool. If you liked the video, subscribe, leave a comment about other things that you might have questions about or would like to see. And we'll see you guys next time. Take care.